A Baker's cyst, also known as a popliteal cyst, is a fluid-filled bump or swelling that forms on the back of your knee. Normally inside your knee, you have something called synovial fluid. This is a slippery, lubricating fluid that helps the joint move smoothly, reducing friction between the bones, cartilage, and other tissues. It's like oil for a machine. It keeps everything running smoothly by reducing wear and tear on the joint. Normally, this synovial fluid stays inside the knee joint itself, circulating as needed. However, when something goes wrong with the knee, such as arthritis or a knee injury, it can cause an overproduction of this fluid. Conditions like osteoarthritis or a meniscus tear cause the knee to become inflamed, which signals the body to produce extra fluid to protect and cushion the area. While that might sound helpful, this excess fluid can sometimes create problems. The inflamed knee can sometimes force excess synovial fluid out of the joint and into a space at the back of the knee. When that happens, it starts to fill up and swell, forming a Baker's cyst. Here's the key part. The fluid can only flow in one direction. The knee has a natural valve-like system, meaning once the fluid is pushed into the sac behind the knee, it doesn't have an easy way to flow back into the joint. This one-way flow of fluid is why Baker's cysts can get larger and more painful over time if the underlying issue in the knee isn't addressed. Now, you might be wondering why it's called a Baker's cyst. Well, it's named after Dr. William Morant Baker, a 19th century British surgeon who first described this condition. Causes of a Baker's cyst. Baker's cysts are usually the result of an underlying knee problem that causes excess fluid to accumulate. Some of the most common causes include: number 1. Arthritis. One of the leading causes of Baker's cysts is osteoarthritis, particularly in the knee. When arthritis affects the knee joint, it causes inflammation, leading to an overproduction of synovial fluid. Rheumatoid arthritis can also lead to this condition, as it similarly inflames the joints and results in fluid buildup. Number 2. Knee injuries. If you've ever experienced a knee injury, like a torn meniscus or ligament, this can lead to the formation of a Baker's cyst. These injuries can cause the joint to become inflamed and produce extra fluid, which can collect in the back of the knee. Number 3. Cartilage damage. Damage to the cartilage in your knee, whether due to wear and tear, trauma, or surgery, can also lead to increased fluid production, eventually resulting in a Baker's cyst. Number 4. Inflammation or swelling in the knee. Any condition that causes the knee to swell or become inflamed, such as gout, infections, or even excessive physical activity, can lead to the development of a cyst. In these cases, the cyst forms as a response to the irritation or overuse of the knee joint. Symptoms of a Baker's cyst. The symptoms of a Baker's cyst can vary depending on its size and whether it's pressing on surrounding tissues. In many cases, people with a Baker's cyst won't notice any symptoms at all, especially if the cyst is small. However, when symptoms do occur, they tend to affect the area directly behind the knee and sometimes the calf. One of the most common signs of a Baker's cyst is swelling behind the knee, which might feel like a lump or bump under the skin. This swelling might get bigger when you're standing up and smaller when you're lying down. This is because movement can increase the pressure inside the cyst, making it feel fuller or tighter. Some people experience pain with Baker's cysts. This pain is usually located at the back of the knee and calf area. It might be a dull ache or a sharp pain, depending on the size of the cyst and what's causing it. The pain often gets worse when you fully extend your knee or when you're active, especially with activities that involve bending the knee a lot, like squatting or climbing stairs. You might also notice some stiffness in your knee. This can make it harder to fully bend or straighten your leg. Some people describe it as feeling like their movement is restricted, almost as if something is blocking their knee from moving normally. In some cases, the cyst can cause a feeling of pressure in the back of the knee. This pressure might extend down into the calf, especially if the cyst is large. Sometimes, a Baker's cyst can cause the whole knee to swell. This isn't just limited to the back of the knee. You might notice that your entire knee looks puffy or feels swollen. In rare cases, a Baker's cyst can rupture. If this happens, you might experience sudden pain in your calf, along with redness and swelling. The calf might feel warm to the touch. This can sometimes be mistaken for a blood clot or deep vein thrombosis, which is why it's important to get any sudden calf pain checked out by a doctor. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of Baker's cyst. To diagnose a Baker's cyst, your doctor will look at your knee, checking for any visible swelling or bulges. They might ask you to bend and straighten your knee to see how it affects your symptoms. They'll also probably feel the back of your knee to check for any lumps or tenderness. In many cases, a Baker's cyst can be diagnosed based on the symptoms and physical exam alone. However, to get a better look at the cyst and rule out other potential causes of knee swelling, like a blood clot, tumor, or aneurysm, imaging tests are often recommended. The most common imaging test for diagnosing a Baker's cyst is an ultrasound, which uses sound waves to create images of the knee joint. This allows the doctor to see the fluid-filled sac behind the knee and confirm that it's a cyst rather than something more serious. An MRI scan might be used if the doctor needs more detailed images of the knee joint, especially if they suspect the cyst is caused by a tear in the meniscus or other soft tissue damage. In some cases, an X-ray might be ordered to check for underlying joint conditions like arthritis or bone deformities, though X-rays don't show soft tissues like cysts very well. In some cases, your doctor might recommend a procedure called aspiration. This involves using a thin needle to remove some fluid from the cyst. The fluid can then be tested to rule out infection or other problems. Aspiration can also sometimes be part of the treatment process, which we'll talk about next. Treatment for Baker's cyst. The good news is that many Baker's cysts will go away on their own without any treatment. As the inflammation subsides, the one-way valve effect of the cyst can become less pronounced, and the fluid trapped in the cyst may slowly drain back into the joint or get reabsorbed into the surrounding tissues. However, if the cyst is causing pain or interfering with your knee movement, there are several treatment options available. Number 1. Aspiration. If the cyst is large and causing significant pain, your doctor may recommend a procedure called aspiration. This involves using a needle to drain the fluid from the cyst, which can relieve pressure and reduce swelling. Aspiration is typically done under local anesthesia, and it provides quick relief from symptoms. However, it's important to note that cysts can sometimes refill after aspiration, especially if the underlying cause, like arthritis or a knee injury, isn't addressed. Number 2. Corticosteroid injections. For more persistent or severe cysts, your doctor may suggest a corticosteroid injection. This injection is typically done after aspiration and involves injecting a steroid medication directly into the knee joint to reduce inflammation. Corticosteroid injections can provide long-lasting relief by reducing the production of excess fluid in the joint, but they aren't a permanent solution, and the cyst may return if the underlying cause isn't addressed. Number 3. Physical therapy. A physical therapist can guide you through exercises designed to strengthen the muscles around your knee, improve flexibility, and reduce pressure on the joint. Strengthening the muscles around the knee can provide more stability and reduce the strain on the joint, which helps to decrease inflammation and the buildup of fluid. For example, simple stretches for the hamstrings, quadriceps, and calves can increase flexibility and relieve pressure on the cyst. Low-impact activities, such as swimming or cycling, can also help keep the joint mobile without placing too much stress on the knee. Number 4. Surgery. In rare cases, if a Baker's cyst is very large, persistent, or causing severe symptoms, surgery might be recommended. This is usually done arthroscopically, using small incisions and a camera to remove the cyst and repair any underlying knee damage. Home remedies for Baker's cyst. If you've been diagnosed with a Baker's cyst, there are several things you can do at home to manage the condition and prevent it from worsening. Number 1. RICE method. This stands for rest, ice, compression, and elevation. It's often the first line of treatment for knee swelling and pain. Rest your knee, apply ice packs for 15 to 20 minutes at a time several times a day. Use a compression bandage to reduce swelling and elevate your leg when you're sitting or lying down. Number 2. Medications. Over-the-counter pain relievers like ibuprofen or naproxen can help reduce pain and inflammation. In some cases, your doctor might prescribe stronger anti-inflammatory medications. Number 3. Use a knee brace or compression sleeve. Wearing a knee brace or compression sleeve can provide extra support to your knee, helping to stabilize the joint and reduce swelling. Compression can also prevent the cyst from getting larger by limiting the amount of fluid that can build up behind the knee. Now, we want to hear from you. Have you ever had a Baker's cyst before? What treatment options helped you manage it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.